A lot of this stuff is sort of earlier signs of aging and or just being overweight. Hi, this is Dr. Roy Kim. The easiest way of thinking about neck rejuvenation is something where it's non-invasive or something that's invasive. In terms of the neck, what we want to know is what exactly is bothering you. Of course, as a plastic surgeon, I think that there are minor things or less invasive things that we can do for your neck. A lot of patients are concerned about maybe a little loose skin, but not that much. Horizontal lines that are beginning to show up. This muscle banding where if you make that expression, you can see the muscles pop out here and here, maybe a little extra fat. A lot of this stuff is sort of earlier signs of aging and or just being overweight. First off, if you are overweight, losing a little more weight will definitely help you. If you feel like you've plateaued, the next step would be to get rid of the fat right here. Non-surgically, what we do is we can inject it with Kybella, which melts the fat, or we could do liposuction, which I think is a slightly better answer in more people that we can actually sculpt it. If you don't have that much fat there, then you may notice that you have a little loose skin. There are non-surgical ways to slightly, as a plastic surgeon, tighten up the skin. These include, of course, some types of cream, which I don't think helps that much, but it may help a little. There is also non-surgical technology, specifically RF microneedling, laser, but very specific ones, and so on. You have to be careful because yes, your skin is tightened, and honestly, as a non-invasive or less invasive procedure, it does tighten up a lot. It's just as a plastic surgeon, I don't think that actually tightens up that much. But yeah, as a plastic surgeon, I do think that it does tighten it up a little. In terms of the muscle banding, to me, this is one of the dead giveaways and sort of easier to fix less invasively or non-invasively. When you grimace, when you have that expression and you have muscle bands pop out, yes, we can actually give you neurotoxin or Botox to these bands right here. They won't pop up as much, and you actually have a much more youthful looking, elegant, longer neck. Also, that platysma muscle, which pops up here, is actually running around all the way under here. If we can give you a little neurotoxin or Botox right here, right underneath the jawline, that actually also improves the heaviness or appearance of your neck, and it actually helps to elongate your neck. In terms of the horizontal lines, well, one thing is to avoid tech neck. In other words, always looking down like that. Another thing is that, unfortunately, this is a sign of aging. How do we fix this? The easy way, non-invasively or less invasively, is to get filler. HA, hyaluronic acid, Radiesse, calcium hydroxyapatite, and a couple others do help. The ultimate filler, of course, is fat, where yes, it's a procedure, but it's a smaller one where we can just extract fat and place it right here, and that helps to not only rejuvenate the horizontal lines and fill them in, but it has a stem cell effect as well. It doesn't matter what kind of filler you get, it will actually rejuvenate your neck. It's just that fat will last a lot longer. Now, in terms of surgery, there are a couple options, and technically you probably need some type of neck lift. Having said that, there are a couple procedures that are more common and less common to do with a surgical neck lift. The whole goal of a neck lift is to isolate the neck, tighten up the skin, sort of underneath the jawline and going back towards resecting skin behind the ear. However, a lot of patients sort of need a lower third facelift or facelift in general to tighten up the jowls, as well as a neck lift to tighten up the loose skin. If you're one of those fortunate patients where most of the loose skin is really around the neck, or you're willing to have a compromise and not necessarily get a facelift incision at all, then yes, that is definitely a possibility. I'm just letting you know ahead of time, you have to be physically assessed. I have to take a look at you to determine what the best treatment plan is for you. In terms of purely isolated neck, surgically, the big things we focus on are tightening the skin and tightening up the muscles. Tightening the skin is more straightforward. We go underneath the skin, pull back, and we try to have the neck skin tightened around the earlobe and behind the ear into the hairline. And that implies that there's no facelift incision. Also, we typically have to make an incision here, not just to loosen up the skin, we have to tighten up the muscles here. When you have muscle banding, we want to have those two bands reunited in the middle so you have a nice smooth neck. And really the only way to do that is to tighten up the muscle bands here and also to physically release them there. That is the major goal of most neck lifts. Now there are a couple refinements. In some patients, the submandibular glands, right here, smaller-ish salivary glands, they are prominent. When you feel it, you feel them, but also when you look at it, they're there. We can either resect them, and actually you can inject them with neurotoxin, which helps them to shrink. Also, the muscles here, they're called the anterior belly, the digastric muscles. I know, a nerdy term. They're more prominent here, and so sometimes you have to remove them or thin them out. Those are the two, I would say, secondary surgical options that can be pursued. They're not done for every case, and to be honest, if you don't have them or they're not that thick or bothersome, I wouldn't, as a surgeon, deal with them because you don't need to. However, some people do have it. Finally, in terms of resurfacing, this is the best time to have something done to your neck skin, because typically you're under general anesthesia. You're already sort of drowsy or sedated. It won't really hurt as much, or you're already having time off for recovery. That's a great time to get your neck resurfaced at the same time. Now, if you have any other questions about sort of the major non-invasive or invasive things that we can do for your neck, please let me know. But in a nutshell, that's really what we can do for your neck. Thanks so much for watching.